My name's Nicole Adams. I'm a registered nurse in Ontario. I graduated in 2005, so I've been nursing full-time since. With that, I've been involved with the Registered Nurses Association of Ontario, or RNAO, and I'm chair of one of their interest groups for staff nurses. And it's through that work that I've been involved in some best practice guidelines for violence in the workplace. And the reason why I became involved in that is, one, I've had some experiences that have led me to want to change the environment in healthcare, as well. As chair of the staff nurse interest group, I was asked to be part of workplace and changing the environment in the workplace. I've worked in an environment where it was very toxic, and by toxic I mean that it was very negative. There was verbal abuse towards the superiors and the nurses and the healthcare aides working in that facility. It was an environment that was so toxic that it started to affect me personally, my physical health, going to work and feeling so sick. But I promised myself that I would never allow myself to be in that position again, that if a workplace became that way, then if I couldn't change the environment, then I would change my place of employment. Currently, I work in a hospital that is a teaching hospital, so I work with a team of nurses, residents, staff physicians, and all of the allied health professionals. And I consider myself very fortunate to work in an environment like that, because for the most part, we work together as a team, and conflict is addressed before it really starts to interfere with relationships between the members of the team. And there tends to be a focus of bringing it back to what's best for the patient. At the time that it occurs, it's best to address it there. Certainly, it's if it's in front of a patient or family, ask the person to step out and try to address it as soon as possible. In situations that that's not possible, try to address it as soon as possible, or with, for example, the charge nurse. If you feel that you need help addressing the issue, oftentimes you're not the only one that feels that way or has had that experience. So speaking to your coworkers. Sometimes it's a personality conflict. I mean, we work with many different individuals. We work in healthcare where we see patients when they're compromised. It's a stressful job as a healthcare professional, so sometimes that plays a role into it. But certainly I would say trying to address it in a professional way. That means to explain no screaming, no yelling, no profanity, no banging of books or telephones, but if you disagree, you should be able to disagree and explain your point and your perspective in a professional, respectful manner. I think having policies on violence, assertive communication, professional communication, and addressing the issues rather in the open, whether it be staff meetings or unit councils. Like, different agencies have different avenues that they discuss issues that are going on in the workplace, and certainly addressing the behavior, involving sometimes the staff physicians, or the chief physician in that department, and basically dialogue, respectful dialogue of how we can fix this and what's best for the patient. And ultimately, I think remembering that having a healthy work environment for the nurses and the physicians allows us to provide better care. I would say, first of all, respect. Communication with respect can go a very long way, as well as remembering that there is no I in team, that in many facilities it is a team approach to healthcare, and working with others and giving them the due respect of their professional background and what they bring to the table is really very important, I think. Respect and communication, though, especially considering the stressful work environment that we often work in. It can be stressful, things happen very quickly, and maybe nurses or doctors can be short with each other or other healthcare professionals. But afterwards, it needs to be addressed. You know what, that's not the best way to address me. I don't like you addressing me that way. So, just simply the appropriateness of communication, assertive communication, but respect.